Hello and welcome to McDougall's Medicine with Dr. John and Mary McDougall. I am your host, Heather McDougall, and tonight, like every night, I'm going to try to get to as many questions as possible, but I get dozens every week and it's impossible to get to all of them, so I'll do my best. Hi, Mom and Dad, Dr. McDougall and Mary. How are you?
Hi. Nice to be with you every Sunday night, 5 o'clock Pacific time. Bring your friends and relatives. We need to save them. My goodness, the things that are going on, Heather, I just feel so sorry for the consumer. You know, all the misinformation they're given and in the face of just making money. You know, there are three things we could talk about tonight. You pick. Or we could just, go on to questions if you like. I'd like to talk about Ozempic face. And I'd like to talk about the new breast cancer study that came out about 2 weeks ago. And the spin that the doctors have done on this study and the newscasters have done on this study.
We saw something on just last night on TV. So
I'm sure. So, we can talk about the spin you're getting. They've taken a perfectly good study. Honestly showed that the treatment for breast cancer is just wrong. They do tens of thousands of breast amputations a year for no reason at all. And they subject women to radiation therapy. Radiotherapy, big deal. 8 sessions going and you burn your skin, you burn your breast, you've got a leathery breast when you're left over. Increases your risk of dying of heart disease if they treat the left breast. And they're just lying about it. And even though the study is clear and half of the reporting is clear. Anyway, the third topic is John Fetterman, Pennsylvania, and how to treat depression. We get into that a lot. So I don't know. I got too much to talk about.
I love that. Well, I would love to talk about the JAMA article first, because we were talking about that in our Thursday session with all the graduates of our 12-day online course. And I can't tell you how many people requested a copy of that article. They were just so interested.
Unfortunately, I can't send that article out to the general public because it's copyrighted. So you're going to have to look it up yourself. It's October. The breast cancer one. The breast cancer one is more recent.
Oh, I have it right here. It's February 16th, 2023.
Okay, so look at the bottom and see if there's a university associated with it.
Massachusetts Medical Society?
Oh, no, I guess you can do it. You can hand it out if you want.
Okay.
That's okay, as long as it doesn't have one of the medical schools I'm a professor at. I forget where I downloaded it from. Yeah, if people want it, I'm happy to give it to them. I actually think it's probably open to the public.
Well, it should be.
Yeah, it should be. Anyway, they did a study where they looked at women 70 years old, or which is the most common time to get breast cancer. And they did a 10.
I mean, I hear about so many young people getting it these days that
I
didn't realize it was a disease that you get when you're older. I mean, there's so many people that we hear about that get it when they're younger. 50s, 60s, 70s. It's quite rare, actually, before 50. Relatively rare, not quite rare. But anyway, they did a 10-year study where they took a group of women and they subjected them to lumpectomies. Now, I don't know whether the lumpectomies were well done or not. I would doubt it. I mean, there's such a variation of doctors. In other words, they possibly didn't get clear margins. That means you got all the tumor when you cut with your knife. And they took these women, they did lumpectomies on them. And then they gave half the group radiotherapy, like I say, 8 sessions usually. And the toxicity is considerable, depresses your immune system, may decrease your survival from breast cancer. There's certainly reason to think so because it suppresses the immune system. Well, how do they do that? Do they implant something?
No,
it's radiation.
It's a machine over the top of the breast.
So you have to go in a machine.
You have to go into a treatment center,
like an X-ray machine or something.
Like an X-ray machine. Yeah.
Oh, okay.
I don't know what the modern ones look like. You can look it up on the internet, but
okay.
They give them this huge dose of radiation. The idea is the radiation will sterilize the breast, which means that any satellite lesions, which is cancer that's spread from the original tumor out through the lymphatic system in the breast. They're called satellite lesions. And also in case they missed some of the tumor in the breast. they give the radiation over the top of taking the tumor out with the idea that it'll reduce the risk of local recurrence. Okay, local recurrence. That means on the breast wall. All right, and it does do that. And so does mastectomy. But you get pretty similar results if you just do a lumpectomy and you're careful, and you get clear margins. Certainly respectable results by doing the proper kind of surgery. But even if you reduce the risk of local recurrence by a maximum with mastectomy or radiation therapy, which is about 30 to 40% reduction. Okay, about 30 to 40% of women who just have a lumpectomy will end up having a recurrence in the breast. I'll make sure you hear that statement, in the breast, which still leaves 70% of women who don't need it. Why treat everybody when only 30% are going to benefit from it? And if it does recur, local recurrence on the chest wall, in the breast area, then these radiotherapists are so good. They tell me they can go in and they can successfully treat the tumor at that time, and you get the same survival results. Or you can do more surgery. You could, if a lump comes back, you just take a little bit more out. So anyway, you're treating 60, 70% of women who don't need it. Only 30%, probably 30%, will have a local recurrence. And I say that's if you do sloppy lumpectomies. Well, they did a study that was just published that showed when they took a group of women, they divided them into those who just had, local lumpectomies, and another group that had lumpectomies plus radiation. It was a 10-year study, and there was no survival benefit. And that's what the headlines were, newspapers, CNN, et cetera. They told you the truth. But then they went and they talked about the local recurrence, which I just told you about. You can treat it if it comes back. And then they said, well, you had to be on hormone replacement therapy. Well, I've talked to you about so many times, hormone deprivation therapy, not replacement. You have to be on a therapy.
A hormone blocker or something.
Well,
right?
there are blockers. You have to reduce the estrogens. You can reduce the estrogen in a woman's body by putting her on tamoxifen, aromatase inhibitors, which is almost always done. Or you can cut her ovaries out, which is a lot more humane than making a woman throw up for a year and lose her hair.
But if you were 70 years old, would your ovaries still even be working?
Not much.
Okay.
Yeah. But in that case, you might get an additional benefit by giving a drug like tamoxifen or aromatase inhibitors, which blocks it at a peripheral level. But yeah, you get a survival advantage if you destroy their ovaries in premenopausal women, either by surgically removing them or chemotherapy. That's what chemotherapy does. That's how it works.
That's much more. That's a horrible treatment compared to having your ovaries.
Well, that's what I say. The women who show survival with chemotherapy are the ones who were premenopausal. So you could make a difference in their estrogen levels by putting them on chemotherapy. And those women who the chemotherapy killed their ovaries, in other words, they stopped menstruating, you see the survival advantage. Whereas postmenopausal women, chemotherapy, you see virtually no survival advantage, except I hold some qualification there. There's some new drugs out, which are kind of testing on the population, and I'll reserve my comments on that when I see a little bit more data. But anyway, you can give the estrogen blockers, the drugs. Mm-hmm. You can take the ovaries out. You can kill the ovaries with cancer chemotherapy.
Yeah.
Or you change your diet. You cut your estrogen levels in your body by 50% if you change your diet.
Because you're not eating hormones from animals anymore.
Well, that's one reason, Mary. The other reasons are the change in bowel bacteria that occurs, the fact that there are certain fibers in plants that combine with the estrogens in the bowel. The estrogens are recirculated through the body, through the intestinal tract, and they combine with the estrogen in your body, and they block it that way, and they reduce the estrogens that way. Plus, you lose weight. In a healthy diet, you lose weight. And as we've talked many times before,
estrogen.
The fat cells in your body make estrogen. So you decrease it in that way. But the hormones of the animals, it basically the change in the bowel and the body that takes place when you switch to a healthy diet. You know what that is. That's a starch-based diet with fruits and vegetables, no animals, no oils. Anyway, let me get on to telling you what really made me mad. It made you mad, I know, is they told women they still have to get the radiotherapy. They told them they have to get it unless they're on a estrogen blocker, and then maybe it's okay. So I'm sure the public is confused. I'm sure my colleagues are not going to make any changes in the treatment of women with breast cancer. Good grief, you put tens of thousands of doctors involved in the radiotherapy business out of business. And think about all the manufacturers of these machines and the radiation. You put them out of business. You want to do that? Just to avoid a leathery breast and doubling your risk of dying of a heart attack and, leathery skin. And
well, they don't tell them that.
Well, it's somewhere mentioned in the informed consent. It should be. Doctors are real good at making sure, just like drug companies are really good at making sure when you go to trial that it says right here, I told you so.
Very small print at the very end of the article.
And ma'am, let's get on with your radiation therapy or your mastectomy, which, by the way, mastectomies, they almost went out of business back in the 1980s when I was involved in the treatment of breast cancer in a legislative way. If you want to read about how I was involved, it's a really interesting story. The McDougall program for women, the introductory chapter, is about my conflicting interest that I had with my colleagues, the Hawaii Cancer Society, the Hawaii Medical Association, the John Burns School of Medicine. We all met at the Capitol. And I wanted them to tell women that surgical treatment doesn't save lives. I could have added at that time, radiation doesn't either. And I wanted to have an informed consent law, just like Massachusetts and California had informed consent laws. I wanted Hawaii to have the third informed consent law, and they fought me terribly.
Yeah, but now they have informed consent laws everywhere, and people are still having mastectomies.
In 21 states the last time we looked.
So it doesn't matter anyway.
No, in fact, they're getting worse. That's what I was going to say. They decreased a bit when there was some activity in the early 80s, and I was involved in this. So I probably pretty much single-handedly, I shouldn't say that, but that's what history tells, and you can read about it in the introduction to the McDougall program for women, which is pretty inexpensive or free. We put it up free often. Anyway, the other thing that you need to know is Bernard Fisher, and anybody who's in this business knows what I'm talking about. Bernard Fisher started studies in 1975, which were completed in 2002. That was a 25-year study that they completed and published, which showed adding radiation to a lumpectomy does not improve survival. So Bernard Fisher's work showed this clearly. And here they are, they're doing another experiment, which shows
they do to women. They probably say, well, you don't want it to come back, right?
Yeah, that's the pitch.
So that's how they get them is, there's a chance it'll come back if we don't give you
But
radiation.
the Informed Women says, if you're a good surgeon, you'll make sure I get cleared margins. So there's a reduced risk of local occurrence. If you're a good surgeon, even if you're a lousy surgeon, generally, it only comes back 30, 40% of the time. That means I could be in the 60, 70% that it won't come back. So you start out by telling the doctor to do his job like he should. And we'll reserve radiation or more surgery for later on if it does come back. And then you say, look, I'm going to change my diet if you really want to make the doctor confused. And probably upset, but confused. You start talking about food. Don't do it. It's one of the things I always tell our patients, Mary, the ones who come through the program. And I have a chance to sit down and personally talk to them. I said, look, when you're talking about the treatments, radiation, chemotherapy, the kind of surgery you're going to have, don't mention the word food, because automatically will come across many doctors' minds. Oh, a health food nut. Oh, you think your potatoes and your oranges are going to take place in my wonderful therapies. No, we're going to judge your wonderful therapies on their own merits. That's what you tell them. Look, you show me that what you're going to do works. We don't have to put food in the equation. the doctor really doesn't care whether you change your diet or not. Doctor likely knows nothing about a healthy diet.
Yeah.
So anyway, I was a bit taken off, but not surprised by the fact that they spun this information to the newscasters, the doctors did, and really took the value of this information away. In other words, we should be closing down the routine use of radiotherapy. Bernard Fisher, his studies beginning in 1975, ending in 2002. Look out, Bernard Fisher, Benard. You look him up.
They do this all the time. Anyway, we were talking about this last week, how they spun the colonoscopy story. And so, what do you expect? That's just what they do.
You need to be a good consumer. That's what you have to do. Anyway, that we could talk about more if somebody asks a question, because I think I've gotten into enough detail. I would read my book, the McDougall's Medicine: A Challenging Second Opinion, and the McDougall Program for Women. And then there are two articles I wrote on breast cancer that you'll find on the website. They're two newsletters, very thorough. The Brutal and Barbaric Treatment of Breast Cancer is the title of one of the articles I published in 2017. So you can, if you're interested, it's there for you to read. The science is there for you to have on your side. If you're a good consumer, you'll fight for your health. You'll fight for your breast. And it's just crazy. But anyway, I was going to talk to you about Fetterman, and we often talk about the treatment of depression, and not to get involved in his personal diagnosis or any decisions he's going to make. But people need to know that you can relieve depression by doing a few things. Getting exercise. What happens when you exercise? You produce endorphins. You know about the runner's high. Sunshine. You know about seasonal affective disorder. You put these light boxes around you, you get rid of depression. Looking good, that helps with depression a lot, and feeling good. The other thing that most people don't know, they don't know about Richard and Judith Workman's work at MIT that they did in the 80s and 90s, which showed that you get dramatic relief of depression by changing your diet. Because what happens when you eat the right kind of foods, you get neurotransmitters built that are serotonin primarily. And these neurotransmitters, they relieve depression. And so people go from horribly depressed to not depressed at all when they eat a good diet. And then the last thing, and the most important thing that people need to know, is too much sleep causes depression. Your alarm clock could cure depression. And the last thing I was going to talk about was, this is the problem with me trying to get prepared for this hour, Heather, was Ozempic face. Yeah.
Mm-hmm.
I sent you a link on that, didn't I?
Yeah. Well, people are talking about it all over. Yeah. There are TikTok videos. I'm not a TikTok person. I don't even know how to get there, but I've been reading that they have videos on TikTok of people complaining about Ozempic face. Yeah. And they lose weight so fast that their skin sags and their face gets all, I don't know. Look, they seem to show pictures of it.
Yeah, well, you're not going to get Ozempic face if you change to the diet we recommend. You are going to lose the weight, and you're going to look better.
Do you think this is just because people lose weight so quickly?
It may be, or they started out really edematous, a lot of fluid, and they lost a lot of weight quick. Well, did they lose a lot of weight quickly? Not much. The average weight loss is like 35 pounds. But and it takes 68 weeks to do it. It costs you $17,000 to be on the, and then you plateau at 68 weeks. You plateau, you stop losing. They don't talk about the plateau phenomenon very often. But the thing I want to add is you'll end up more attractive. There's a whole lecture, Heather, you've got to get me to give that. I'm done with it. A whole lecture on sex and attractiveness. Maybe that sex part has kept you away from me giving it to. I won't get too personal. But I've got this lecture ready to go. And one of the sections on this lecture that I talk about is about the color pink or red or orange. These are colors that people are attracted to. monkeys, for example, just to get to one of our lesser primates, when they ovulate, the female ovulates, her cheeks and her buttocks turns red. Red is a signal that you're fertile and you're attracted. Well, how do you make yourself red? Well, you wear red clothes, and women are known to, during their time of fertility, during the month, to more commonly, they choose red clothes. Anyway, red dresses and so on to broadcast their fertility. I'm sorry. I know the human being wants to hide their fertile time. It's part of our nature. I don't know why, but we do. Anyway, so you can put more redness in your skin by getting in the pink, by improving your circulation. Remember, I've talked to you many times about how eating a high-fat diet drops the oxygen content of the blood by 20%. And, oxygenated blood is red. Deoxygenated blood is blue. All right. So you change the circulation immediately upon changing your diet. And you also end up getting out of the pink by eating a bad food for a very short period of time. All right. So you get a little more red. That's a primary way. The other kind of thing that's kind of interesting that a lot of people can relate to is caroteniemia. You know what caroteniemia is?
Yeah, it's when you turn orange from eating a lot of carrots.
Well, orange is a color of attractiveness. They've done that with scientific studies. They've had people eat a certain amount of like carrots, and they'll show them pictures, and they'll grade the attractiveness based upon how much carotene they've eaten. And the change in color of their skin increases their attractiveness. So when you switch to the McDougall diet, there are many, many things in addition to lose weight in a healthy manner that you end up in the pink, more attractive. So, hey, fortunately, this Ozempic stuff is getting a lot of backlash. Hey, I got in all three things I want to talk to you about.
I know, that was great. Only 20 minutes.
Yeah.
So. Okay, well, I've got lots and lots of questions. So let's see. First one, this is from B. Duncan. I've been whole food plant-based for 6 months now. My white blood cell count is low, 3.1. Do you have any recommendations to raise it?
No, it's going to be low. This is just a typical thing that happens when people go from sickness, where they have lots of white blood cells called into demand. Oh, you're sick. You're eating a Western diet. So part of the response to sickness, you become inflamed. The sickness is due to the knife and fork, by the way. It causes injury to the tissue. The response is inflammation. And so what happens when you get inflamed? What happens when you get an infection? How about if you get appendicitis? What happens to your white count? All right, when you stop having, we're not talking about having appendicitis or any major infections, but when you stop having this low level of chronic inflammation, due to the food, which causes the body to respond, and part of the response is an increase in white blood cell count. When you stop doing that, you put yourself in a healthy state. What is your body going to do with the white blood cells? It's not going to produce as many. And the normals for white blood cells, just like the normals for almost every other test, is based upon what the average American has. So if you want to be compared with sick people, then you want a white count, I think it's 5 million. You're 3.1 million. So, I can get your weight count up really fast with a couple of steaks, a couple of breakfasts of bacon and eggs. Yeah, I can get you inflamed. I can get your weight count up. So what I'm trying to tell you is forget it. It ain't a sign of sickness. And in fact, it's a sign of improved health. It's like we should put criteria. People say, well, how do you know you're getting better? Well, my cholesterol went down, and my triglycerides went down, and my uric acid went down. Well, your white cell went down too. Your white cell count went down.
Good.
Yeah, we got to do that as a test. But anyways, that's what our research shows. And yeah,
that makes sense.
Oh, good. I'm glad I pulled that one off on you.
Okay, thank you. Next question. This is from Susan. She wrote in, she is on Muro 128 eye drops 4 times a day to help the swelling in her cornea. but wondering if there's anything else she can do to help this condition. Any foods? Is it hereditary? Any ideas?
Swelling of her optic nerve?
No,
Of the cornea.
Cornea, I know. I've never heard of such a thing, but I'm sure it exists. And I wouldn't know how to treat it since I've never seen it or haven't even read about it. I'm aware of swelling of the cornea. Maybe swelling of the cornea is a precursor to serious enough inflammation that it causes cataracts. All right. Well, one of the things that inflames the cornea is galactose. It's a sugar, galactose. Galactose is a breakdown product of lactose. Okay, you know where lactose comes from. It's the secretion of the mammary glands. Okay, so lactose breaks down into galactose and glucose. The glucose isn't a problem. The galactose causes inflammation of the cornea. And if this theory applies to you, then yes, you can. You change your diet and get the galactose out of your diet. How do I know this? And how can you find out that there's some value to what I just told you? You can look up galactosemia, and see the high incidence of cataracts. People who have this genetic difference, where they can't metabolize the galactose and have very high levels of galactose in their body and bloodstream. They have cataracts in their teens and 20s from the damage of the galactose. So you stop eating the dairy. That's one thing I would tell you to do. But it could be other things like it's cataracts, or when you tell me inflammation of the cornea. This is inflammation of the lens. The cornea is on the outside of the eye. But
you may swell after eye surgery, injury, infection, or inflammation.
Yeah, I'm getting cornea and lens mixed up. But the same thing applies to the eye tissues. I would think they would be the same. But now you got a nice lecture on getting cataracts. All right.
Thank you. Okay, next question. This is from Natalie. She wrote in and is, I think, newly diagnosed with gestational diabetes and wanting to know if adopting a plant-based diet would be a good idea. Any concerns since she's pregnant?
How often would it cure gestational diabetes? The diet I recommend 100% of the time. Yeah, you don't get gestational diabetes if you live like the diet used to be in China. There's an experiment done on it's kind of a health resort in Kentucky. I wish I remember the name of it, but they had 77 pregnancies that they reported on. They had one case of eclampsia, and they had no cases of gestational diabetes in this report.
The people ate the way we do?
Well, yeah, they did. They're vegans, these health food hippies. And
that's not the one in Tennessee, is it?
It is.
Summertown?
Yeah. What is it called?
Summertown?
That's the one. See why I bring her along. Anyway, you can look this up. You can probably find it in my book, The McDougall Program for Women, in chapter 5. That's where I would look. Or no, maybe not. But one of the chapters, I would look it up in the index. Eclampsia, preeclampsia.
Probably find it on Google if you put in Summertown and pregnancy.
Thank you, Mary. So anyway, type 2 diabetes, which is what gestational diabetes is. Type 2 diabetes is 100% curable with weight loss. For any reason. You can starve. You can go on the Atkins diet. You can have your teeth wired together. You could probably even Ozempic. Well, that's why they get.
But you can't do any of these things when you're pregnant.
Yeah, I certainly wouldn't.
No.
But that what they hear from.
But you can eat healthy when you're pregnant.
Well, not according to their mother-in-law. not according to maybe their doctor.
Yeah.
But the healthiest diet there is for a pregnant woman is a starch-based diet with fruits and vegetables. Almost every person born on this planet was born to a mother who ate a starch-based diet.
Not anymore.
No, but
years ago.
Anyway, I would say it's 100% curable. Type 2 diabetes is 100% curable with weight loss. What is the best way to lose weight? It's with our program. Why? Because you're eating. You're not taking shots that cost you $17,000 for a regime, which comes to a plateau at 35, 36 pounds. You know, you're not going through gastric bypass surgery. Boy, there's a problem with pregnancy. Once you start cutting
Well, they wouldn't let people do that, would they?
Yeah, they do. They're women who plan to get pregnant who have
Oh, they wouldn't, but they wouldn't do it while you were pregnant.
No, they would never do it while they're
Okay.
pregnant.
So it would be someone who already had.
And then you have all kinds of problems with pregnancy. But there's a whole bunch of reasons you have problems with pregnancy. As somebody who's set up for that kind of surgery. But anyway, yeah, that's what I would do. I'll stand by that. Yeah.
Thank you. Okay, next question. This is from Shamika. She's wondering if she can eat textured vegetable protein on the starch solution.
Well, TVP, you got to give your little speech on TVP.
TVP is soy protein.
Yeah, but
Isolate.
but not TVP that you.
Well, that's the TVP I make, but when you buy it in the store,
yeah,
it is soy protein.
It's isolated soy protein, which increases your IGF-1 levels, which increases your aging, increases your risk of cancer. It has twice as much calcium losing effect as skim milk does on the body. Isolated soy protein.
That's what it stands for, is textured vegetable protein.
Not a Harry McDougall talks about. Yeah, you're right. You're right. I'm sorry to confuse you. I just wanted to get on your.
Well, yeah, I can talk about. You can make your own TVP, and it's healthier.
And if they look through your recipes, they'll find.
Yeah, I think it might even be online, but you just take a block of firm tofu and you go like this with it in your hands until it turns into all these little crumbles, and you bake it in the oven until it becomes quite firm and hard. And that's what homemade textured vegetable protein is.
That you can eat.
When you buy it in the store, it is commercially made, and it's
a concoction of chemicals. You know, the way they do this, they take the soybean, cook it, grind it up, wash it with water, alcohol, an alkaline solution, and an acid solution. And with each washing, they wash something away. They wash the protein away, the carbohydrate away, the fat away, the vitamins, the minerals, and all you're left is with protein. It's isolated protein. And it has a detrimental effect on the body to eat that level of protein. So, you know, I just mentioned a few things. It's really hard on the kidneys. The answer is no, that's not on the program.
Okay, great. Thank you. This next question is from Billy, and he's wondering if there are any recommendations or updates to the McDougall Plan book that was written so many years ago.
Pretty much no. Let's see. My recommendations on B12 have changed a little bit. I
think so. There's something in the front of that book that tells you have to take B12.
Well, you do have to, but the different sources of B12.
Oh, okay.
You know, there's some question about some of the reliability of natural sources of B12 that I offered. But there's a lot of issues of B12 that I didn't include in the plan, which I included in the newsletters. I wrote 2 newsletters. You can just go to our website and you can put in the question mark. You can put in B12 and you'll find out other ways you can get B12, like nori, seaweed.
Seaweed.
And the reason you have B12 on seaweed is because you're eating animals. Little animals grow on those seaweeds, yeah. So no plant, no animal makes B12. They're made by bacteria. And so anyway, so I would say I would change that. You know, when Craig, your brother, the full professor at Oregon Health and Science University, that's what he does. He's a medical doctor and a full professor. When he read the starch solution, he says, Dad, why'd you bother? You already wrote this when you wrote the plan. Like, that was written in the early 80s. Starch solution was written in 2011. why did you do this? You already told them everything. I said, yeah, but I told them a lot better in the Start Solution, which is a tremendously better read for you. Believe me, if I recommend any book to anybody, it's the Start Solution. But the plan is where we started. And the plan is one of those books we give away quite often. I don't know. Do you have anything for free these days, Heather?
I don't. I did share a link in the chat where you can purchase all of our ebooks, and they're about $10. They're cheap, but no, I'm not giving any away right now.
Well, we just missed Valentine's Day. You could have given the hard book away.
You're right. That's a great idea.
Next year.
Next year.
Okay, let's see. Next question. This is from Eve. Can pulmonary issues like asthma be helped by diet?
Absolutely. Yeah. The article, I believe, is titled Breathing Better, and you find it on our website. And it talks about this is actually discussed at pulmonology meetings, the fact that a high-fat diet worsens asthma. And part of the treatment, this is standard medicine. But let me tell you the reasons why a healthy diet helps with your breathing. One is the blood sludging issue that we talk about a lot, and I'm not going to go over it right here. But if you look around on the website, the lectures I've given you, you'll find a video I show about how the blood sludges when the cells stick together as a consequence of eating fat. And eating vegetable fat causes a more severe reaction. So it's even worse than animal fat. So you drop, and this is shown in people, you drop the oxygen content of the blood by 20%. That's one thing that happens. The other thing that happens is you develop bronchospasm from allergies. And dairy is probably the most common reason to do this. The next thing I would talk about as far as improving breathing, and again, we're talking about asthma here, is losing the weight. You take a tremendous amount of burden off the diaphragm when you do that. So I would say that probably the improvement in the immune system that takes place. Oh, I'll tell you another reason it helps. Standard. Boy, I tell you, I like to tell you when my colleagues got it right. And often they got it right before I did. So don't think that I'm trying to tell you that they're way behind. Is that every doctor who's dealing with people who have asthma recommends that you raise the head of your bed if you have asthma. Why? Because one of the common causes of bronchospasm, where the airways, they go into spasm. That's what asthma is pretty much. Is reflux of gastric contents when you lie down, particularly people who have hiatal hernias or disruption of the lower esophageal sphincter. What happens is the stomach contents, full of acid and a bunch of other digestive substances, they go up the esophagus, and they get on the teeth and take the enamel off the teeth, get in your vocal cords and cause hoarseness and cough, and you inhale these acids, get in your sinuses and cause sinusitis. You inhale the acids, the acids, which causes bronchospasm. So you should expect all of your physicians, particularly if you ask them, don't you think I ought to raise the head of my bed, doc? Well, that's important to raise your head of your bed, but you also ought to know that the reason you make acid in the stomach is to digest meat and dairy. Yeah, because they're high protein foods. And that's what the acid in the stomach does primarily, is it digests the proteins in animal foods. So
it's amazing how much.
If you're a veterinarian here or you're a cat lover, you know this, because if you look at the acid content of a cat, but they're supposed to eat meat, right? Acid content of a cat versus the acid content of a human being, there's a 7 times difference, maybe 10 times difference in the acid content. So anyways, that acid ends up going into your airways. It's called Breathing Better. It just put those terms in the website. You should be able to find it with no trouble at all. It's in my May 2003 newsletter, I believe. Could be wrong on that one, but I'm pretty sure it is. You ask me, why do I know this? Well, I spent a week or two writing these articles.
Yeah, but still.
I still can't believe you.
No.
I'll tell you where you will find it for sure. You go to the website, you look under hot topics, you look under medical topics, and then you look under heart disease. And the last article is the breathing article. I know it's there.
I put the link in the chat so you can find it there.
Did you find it?
Yeah.
All right. Thanks, Heather.
Okay, next question. This is from P2. They are wondering if there are a healthy 60-year-old, do they still need to get annual physicals?
You should never get an annual physical. There again, I'll take you back to my website. Go to the website, look under hot topics, look under medical. And the last section is on working with MDs. And what is an article about the value of a yearly or routine physical examination? And they are condemned by the American Medical Association, the American College of Physicians, which is the certification program for internists like myself. Every organization I know of condemns an annual physical. Why? Because you end up doing more harm than good. You end up finding things on the patient that would never trouble them. So the idea of getting an annual physical is just old news. I wrote that particular article probably 20 years ago. Needs no updating. I once in a while look at the new articles I put out about the annual physical. Don't do it. Now, should you get some things checked once in a while? Yeah. I think you should check your blood pressure maybe once a year. I think it'd be a good idea if you want to kind of stay on track. You don't have to do it. I haven't done it in years. Get a routine blood test like, a blood sugar, cholesterol, triglycerides, just to kind of, these are things you could do yourself. You don't go to a doctor for them. You should get a hearing test when you get into your 60s. And you should also get an eye exam, which looks at the eye pressure for glaucoma. And those are reasonable things. And then there's a whole bunch of cancer things that we've talked about. I recommend screening tests. I only recommend two of them. One is screening for colon cancer by using a sigmoid exam or Cologuard or a blood test of the stool. And I also recommend Pap smears.
But you don't recommend people have that more than one time. It's not like you do this every year.
No, you do it once between the ages of 60 and 75 years old, the stool examination. If you pass, you're done. And then as far as the Pap smears, which is the other thing I recommend, these are things on the surface of the body, things you can look and see. Whereas the other kind of cancers are inside the breast, inside the liver, inside the kidneys, inside the brain. You can't go look and just take a little scope and look at them. Anyway, sexually active women, say beginning at age 28 years old, sexually active. Why? Because this is a venereal disease. It's spread by a wart virus. So
I'm talking about cervical cancer.
Yeah, cervical cancer, right? And then you could stop around age 50. I think is enough. Almost all organizations recommend you stop at age 60, getting Pap smears.
But you don't recommend them every year anyway.
No, again, it's in line with all the other organizations out there. You look up any gynecologic organization, including the American College of Gynecology, and every one of them worldwide, and you find they all recommend that you get a Pap smear every 2 to 3 to 5 years. Those are the recommendations. Not every 6 months. That's plenty to get every 2, and then you stop at age safe. I recommend 50 is enough, but 60 is agreed upon.
But, people that
if you had a hysterectomy, don't go fall into that one, ladies. You don't need to.
Our age, they remember what it was like when we were younger.
Yeah.
When I was younger, everybody went for an annual physical, and every woman had to have a yearly Pap smear,
Or every 6 months.
Yeah,
Depending upon how
things have changed, but people that are older like us, they remember the old recommendations.
Yeah.
So
Well, they carry on. People forget slowly. And, but, if you thought that these led to only good, that would be okay. But they lead to harm too. They lead into further testing and treatment, which costs you money, puts you at risk, harms you, and sometimes kills you. So you better be careful about questions you ask. And you go in for a general physical examination, you just ask 100 questions. And most of them will lead you into more harm than good. That's why every organization recommends against them. I don't know of any organization that recommends an annual physical exam. I mean, official medical organization. You can find one and email me and tell me about it. I'd like to hear about it. But read that article, Working with MDs. I told you how to find it. There's an article in there on the annual physical.
So to clarify, even if you're younger than 60, you still don't recommend? Absolutely
not. You should not do it. No, and I just gave you the cancer recommendations for, these would be people under 60. The colon exam and the pap smear. So, no, I don't care what age you are. But, Heather, when I was a young boy, University of Ann Arbor, we lived right outside Ann Arbor, Michigan. And the University of Ann Arbor had a real famous hospital. And my dad used to take my sister and I every year to get an annual physical examination. We must have been like 7 years old.
Well, I remember that. I think even when Heather was born, they had baby checkups. And you take the baby in every year. They were called baby checkups.
They're called cash. That's how you pay the electric bill.
So I don't know if do they still have this for kids? I have no idea.
Well, it's based on false pretenses. I don't know. Look, again, looking at the big picture, there have been 100 billion people born on this planet. How many of them went in for
baby checkups?
How many went in for baby checkups? Yeah, it's just, and the thing is when we were young, Mary keeps going back to in the old days, when we used to walk uphill both ways in the snow. Yeah. Things are much better now because of information. This is why I have so much hope. I've gone from a very depressed man who thought that things would never get better to where these days, I look at the things that are happening in the world due to effective communication. 86% of people on this planet have access to a device where they can get instantaneous information.
Yeah, not all of it's good.
We have the potential to do great good now, and I see it happening in the healthcare business, just like the studies I just talked to you about, the colonoscopy study, which we talked about last week, which you say, and then the breast cancer study. This information is getting out, ladies and gentlemen. You can't hide the polluters, the cheaters, and the liars. We're going to catch them.
I hope so. Okay, next question. This is from Yvonne. She's wondering what your thoughts are on magnesium glycinate supplements. I guess wondering if too much thins the blood.
Well, it gives you diarrhea, it thins the stool. So, milk of magnesia, et cetera. Magnesium gives you increase in bowel movements. I think it's a bad idea. And the reason I think it's a bad idea is a couple of research articles, and you'll find them. Let's see. I don't know. I'll think about it in a minute. But anyway, you'll find them probably in McDougall's Medicine. Anyway, not important. But look up magnesium and heart disease. And what you'll find is in one study, what they did, Heather, is what we found out, and again, this is in my time of practice when I was a young doctor, is we found out that people who had heart attacks, when they did the initial blood work, they found their magnesiums were quite low. And that was because a good share of them were on diuretics. These are people who are, in trouble with their cardiovascular system and they have a heart attack. So because they were taking diuretics, the magnesium got washed out through their kidneys. So what we did initially, and I think it was a good idea, is we gave magnesium to these people in the emergency room before they even went up to the coronary care unit. intensive care. We give them magnesium to try and correct the problem. Well, investigators decided to continue this experiment after people left. And so, I could show it to you. I can't think of where it is at the moment, but I could show it to you, where in a really good study, they compared those who left the hospital after a heart attack and got magnesium and those who got placebo. The ones who got magnesium had more heart attacks, more death, more heart surgeries compared to those who got the placebo. Well, it's a bad idea.
Well, why did it work when they first came in?
Well, I don't know that it really did work, to tell you the truth.
Oh,
But I mean,
but they gave
you see a problem, and this is what we do,
Okay.
especially in the emergency room. I don't know that's been proved. It's sort of easy to look up. Just look up randomized control trial in an acute setting, or heart attack.
Okay.
See what happens. See what you find out from research. And if you want to have diarrhea, take magnesium.
Okay, thank you. Next question. This is from Bo, and he's wondering, for younger kids, would you recommend higher intakes of healthy oils and fats, nuts, seeds, avocado, etc.?
This is a general recommendation that I think is worth doing. And I'll tell you why. You start out in life with a diet that's 50% fat. Okay, that's what breast milk is. It's 50% fat. So you're in the process of myelinating your nervous system, putting myelin sheaths around the brain and the nerves, and a whole bunch of other demands in a young child. A baby doubles in size in 3 to 6 months. They need a lot of fat at this time in life. They get it from breast milk. So, you go from this very high fat diet, one that you should never be feeding to people, adults. You go to, say, 2-year-old, which is about the time when you should consider weaning, and you still have rapid growth. So I think it's reasonable to add nuts and seeds and avocados as part of the diet. In fact, it's something I've recommended in several places and the things that I've written. Yeah, that's fine. But you don't want to get them in a situation where they become obese. Consider the fact that 17% of the school children are obese, not just overweight. Not just overweight. If you go to you add overweight to obese, the two together, you're talking about 40-50% of the kids have a weight problem. And of course, it's such a bad problem that, remember, the American Academy of Pediatrics came out 2 weeks ago, made headline news, got a lot of folks upset. They came out and said that starting at age 12, you can start giving these GLP-1 agonists like Ozempic. No, well, the Ozempic isn't approved for weight loss yet, but Wegovy, yeah. You can treat these kids at 12 years old with this drug. It just came.
I thought you said they could also do
13. You got to wait till you're 13
before
they'll do intestinal bypass on you. This is crazy. What kind of society allows their children to get into this situation? Civilized people protect their children. It's just a basic law of humans. That's the way civilized people act. What is going on?
Well, the parents are overweight too, so it doesn't seem to be.
That's all the kids know is. There's a lot of blame to go around, but being uninformed. Well, we're trying to fix that and correct that. But yeah, there's just so much misinformation, and it's so cheap because partially of subsidies from the government for our fast food. It's so inexpensive to eat this rich, obesity-causing food, heart disease-causing food, cancer-causing food, constipation-causing food. It's inexpensive, and that's what the kids start learning to like. And then they want McDougall's. Oh, I don't want to have oatmeal. I want to have an egg McFried muffin or greasy cheese laden. Give me one of those, Mom. And Mom says, I got a busy day. I suppose we could just do one. Yeah, anyway, it's like I said, there's plenty of room to be to go, plenty of room for blame to go around, but it doesn't matter. We got to start informing people correctly. And that's why I feel optimistic, is I think we really have a chance to tell the truth and to let people see the truth, even though there's a lot of money behind lying.
You're doing the right thing, Dad.
I keep trying. Sometimes people ask me, how can I do this? I've been doing this for 47 years and I keep a smile on my face. It's because once in a while I catch somebody and they do it. And as a result, they get exactly what we tell them they're going to get. And our star McDougall's, which come out about once a week, explains such a miracle. And the thing you need to know is it always happens. This is not the best case scenario, like Jenny Craig will tell you, or Nutrisystems. They show you examples. And they say, this is the best case scenario. Don't expect these results. Ladies and gentlemen, I think you should, I know you should expect these results. You're going to get them. Just like if you quit smoking, you're going to have, less chance of coughing, less sputum coming up. You quit a third of a bottle of whiskey a day and you'll have less chance of falling down, I bet. You change your food from the Western diet, which is dominated by animal foods and oils and junk, to a starch-based diet with fruits and vegetables, you'll get every single one of the benefits that we've talked about with more ease than you ever expected, except you've done some permanent damage that can't be reversed. There are a lot of things. Good grief, you've been doing this for 40, 50 years. You've got scars in your arteries. You've developed arthritis where your fingers are all crooked. They're not going to straighten out with potatoes. So be realistic. You can only get rid of the rheumatoid arthritis by eating well. You can't straighten the fingers out. So neither can you with the drugs that they're advertising on.
I'm sure.
Have you memorized all those drugs yet?
No.
You got to feel them down, don't you? She said, we sit there and watch, we watch too much cable news, but she sits there and watches. She goes, oh, I know.
Rimbaud.
Rimbaud. Okay, I love Rimbaud. She says, oh, guess what? They just used this one.
Rimbaud is good for colitis.
And
it's also good for psoriatic arthritis.
Oh my goodness.
And there's something else too.
These are
IBS.
There you go. Yeah. I mean, you can almost treat everything. And you can almost treat everything with these new drugs that are out by suppressing your immune system, just like we used to do with steroids, corticosteroids. We thought it was a cure for rheumatoid arthritis when I started in medicine. But nobody is treated with.
Nobody uses those anymore, do they?
Not anymore. They're just on desperate situations.
Yeah.
Because they don't cure it. They just make the inflammation go away. That's all. So we can at least do that. And we call it a cure. No cost, no side effects.
Okay, we've got 3 minutes, so I think I can fit in another question.
I bet you can do.
Okay, well, we'll go fast. This is from Naomi. My husband recently had open heart surgery and could only do a double bypass rather than the quad due to calcification in the arteries. My question is, can a clean diet get rid of the existing calcification, or is it permanent?
It's permanent. These are scars. You really ought to watch the lecture that's on YouTube that I gave on heart disease. These are old scars. Doesn't matter. They're stable. They're non-lethal. They're not going to give you any trouble at all. They're just going to sit there. And obviously your husband, because he's, still your husband, is doing well with the amount of circulation he has. You just want to prevent the pustules that are in the arteries from rupturing. Scars never rupture. Calcified lesions never rupture. So that's all you want to do. You just want to, you have past that you can't change. He's doing good. He's still great to have around, but you could stop the progression of this disease and improve all kinds of things. But you're not going to get rid of the scars and the calcium. If you're expecting that, you're wasting your time.
But that's okay, right? I mean, that's
yes,
not what your goal is.
No trouble at all. Hey.
No, most of these arteries already have formed different the veins and the
Oh,
arteries and
collateral
collateral
Yeah,
circulation.
he might have a lot of collateral. I'm sure they did as much bypass on your husband as they could. You know, that's their job. That's what they do. They do it well. But bypass surgery does not save lives, period. You know, there's one study that came out that showed at 5 years, there was no survival benefit. They had to wait till 10 years, and they found only severely ill people at 10 years got a tiny survival advantage. Anyway, what's the next question, Heather? Are you
We're
done?
done.
Oh, I think we're done at 6 o'clock.
6 o'clock.
Well, okay. Let's see. What do we got coming up here? We've got a free lecture that I'm going to be giving on bizarre weight loss. Do you have that scheduled date, Heather? Bizarre weight loss.
March 1st.
March 1st.
March 1st. But you've got to sign up. You've got to be part of our communication system. What it used to be called a newsletter list, so that we can invite you to this particular presentation. It's free. Heather and I decided to open to the public. So we got that. We have, I'm working on another series, which is about medicine. It's a series of 10 lectures. You can sign up for that pretty soon too. And then we have a program running. When's the next 12-day program? Look,
March
ladies
3rd.
and gentlemen, I promise you,
Right after the talk.
you're going to look back after you take the 12-day internet-based program. You don't even have to leave your house or your kitchen. You're going to look back, and just like so many other things in life, you said, why didn't I do that before? Why did I wait so long? Anyway, we'd love to have you in the program. It fills up pretty fast, so get involved. Dr.
Great, that was fun.
Yeah,
That went by fast.
it did.
Thanks,
Oh.
Mom and Dad, Dr. McDougall and Mary. We'll see you next Sunday.
Yeah.
Thanks for tuning in, everyone. See you next Sunday at 5 p.m. Pacific.